This video training, we're going to be talking about various situational examples that you encounter as an employee in an optometric practice. On a daily basis, staff are constantly encountering or dealing with patients that are complaining or having concerns about things like pregnancy, diabetes, wanting to know about surgery, experiencing discomfort sitting in front of a computer. And so in this video training, we just highlight why people would complain about those particular problems and what information you need to know that you will have to be able to communicate effectively to the patient, and what tips and recommendations at the level at which you're an employee you need to be in a position to give to those particular patients. So let's look at the first one, digital eye strain, for example. There are a lot of people who sit in front of computer screens, smartphones, and other digital devices for long periods of time during the course of the day on a weekly basis. And so this may cause the eyes to feel dry and tired, and in some cases, they can develop blurry vision, fatigue, or even eye strain, correct? And so what I've just mentioned now is as a result of the fact that we don't blink as often as or as regularly as we should, and which forces us to experience a discomfort when we're in front of these digital devices. And so some tips that you as a staff member can be able to reiterate to the consumer is as follows. Tell them that you've just prescribed a pair of spectacles to them that have got the necessary coatings that the optometrist has recommended, or they're coming to you complaining of that particular associated symptoms related to digital eye strain, right? They don't know that it's digital eye strain, but you know. And so tell them that, look, some of the things that you should have been doing is sit at arm's length from the computer screen, for example, position the screen so that your eye gaze is slightly downward, reduce glare by using a matte screen filter if needed. They should be able to take breaks using the 20-20-20 rule, whereby every 20 minutes shift your eyes to look at an object at least 20 feet away for at least 20 seconds. They need to be using the necessary eye drops as prescribed by the optometrist whenever they feel dry in order to refresh their eyes. And of course, they need to adjust their room lighting and try to increase the contrast on their screen in order to reduce that strain. So those are some of the things that we are able to communicate to patients. However, most importantly, it's getting them to have their eyes examined, because once they have their eyes examined, a proper diagnosis can be able to be determined with accompanying signs and symptoms that perhaps they're not complaining about, but that the results are revealing. And with the management solution that is recommended, you are then in a position to say, look, unfortunately, or fortunately, that issue you're complaining about, the only way that we can be able to solve it is with a pair of spectacles. And we've got different coatings based on what you complained and based on the results. The optometrist has recommended the following pair of spectacles for you, and this is the clinical features and benefits of this coating versus this one. And so if you go with this, understand that this is what you're going to experience with your pair of spectacles. If you go with this is what you should expect to experience when you're wearing the pair of spectacles. So you need to be able to know what people are complaining about, how it's affecting their working environment, their living environment, and what solutions are best suited for the type and extent of the problem that they're complaining about. Tips for contact lens users, for example, they need to be giving their eyes a break from by wearing spectacles. They shouldn't be sleeping with their contact lenses unless it was specified for that particular purpose. They must always be using good hygiene or good cleaning practices pertaining to their contact lens usage. And if their eyes are constantly red, blurry, or watery, or they become sensitive to light or painful sensitivity to the eyes, they need to be seeing the optometrist with urgency. It should not be something that they think that it's going to be going away. And so you need to know these things so that you can be in a position to effectively communicate adequately with the patient. Understand that this level of complaint will best be suited with this management solution. The next level of complaint is going to be best suited with this particular management solution. Understand the different coatings that the practice is constantly prescribing to patients. Understand what value this coating adds compared to the other coating. Understand when someone has associated complaints whereby they also struggling to see, but they also have light and glare sensitivity challenges, and they've got a high prescription, what coating will go best with that. So it's very important that we can educate our patients pertaining to digital eye strain so that they know and look for the opportunity. Someone comes into the practice and they say, look, I want to make an appointment to have my eyes tested because I'm complaining of the following. Ask them, sir, I see you wearing a pair of glasses. When was the last time you had your eyes tested? No, I have my eyes regularly checked every 2 years. So you've got a coating on your glasses. Do you feel that the coating on your glass works for you? He's going to say to you, not really, because I still have the same complaint that I complained about, though without the coating, it's going to be far worse than with this one. Then, so there are different coatings that actually exist. We've got a basic, intermediate, and a more advanced option. And so the optometrist will be able to tell you the type of coating that you have. But in terms of our practice, we've got this coating and it does the following. We've got this coating, it does the following. And we've got this coating and it does the following. The fact that you are saying that with the coating that you have, most probably it's a basic option. It's not providing you with the visual experience that you feel that you need to be having. And so we would highly recommend that we upgrade you from the current management solution that you are wearing to a more advanced one, which can be able to give you a better visual experience. That's how we introduce products in the discussions that you are having with patients. The mistake that we tend to be making as eyewear consultants is that a person complains of something like digital eye syndrome, and then we introducing the most basic anti-reflective coating in the discussions. Then at the end, when we want to upgrade them to a more advanced one, it becomes difficult because why? They are different in price as well. So make sure that you are having the open discussion with the patient from the onset in order to introduce them to the right products from the onset, because once they understand that, oh, this problem goes with that solution, this problem goes with that solution, they are able to make informed decisions pertaining to their visual wear. Next one, pregnancy. Whenever a woman is pregnant, her eyes may possibly change as a result of any of the following: fluid retention, increased blood volume, hormonal fluctuations, and of course, physical shifts that are part of the pregnancy. Most often, these changes are usually temporary and resolve after the baby is born or after wearing a weaning off breastfeeding of the child. And so vision changes tend to be minor and don't require a new prescription. However, always remember to inform the pregnant lady that, for example, things like LASIK surgery should not be done when a woman is pregnant or breastfeeding. So just some of the tips that you need to be aware of. And ask the optometrist that, look, when do we tell the patient this information? When do we book them for an appointment? What happens with the eyes at 3 months pregnancy, at 6 months, at 9 months, 6 months after the delivery? When should that person change their contact lens prescription? The optometrist that you're working with needs to indicate to you that if a person is a contact lens wearer, for example, and they're about to give birth, what are the visual changes that they're going through? And if they urgently need to renew their prescription, the results that we find in that examination, how will that change post delivery? So it's very, very important that you're in a position to know this information so that you can adequately advise and inform and educate patients pertaining to that. Next one, let's look at diabetes. Diabetes is a disease that affects the body's ability to produce or use insulin effectively to control blood sugar, which is the glucose levels, right? And so although glucose is an important source of energy for the body cells, too much glucose in the blood for a long time can cause damage in many parts of the body, including the heart, the kidneys, the blood vessels, and small blood vessels which are in the eye. So a diabetic retinopathy is when the blood vessels in the eyes, retina, swell, leak, or close off completely, or if abnormal new blood vessels grow on the surface of the retina. So that's basically a short description of what diabetic retinopathy is, which is a common condition associated with people that have diabetes. And so people who are at the greater risk of developing diabetic retinopathy are diabetic patients, obviously. People who've got poor blood sugar control, pregnant women, high blood pressure, high blood lipids. And so the vision in the eyes may still change or fluctuate, even though a person may not present with diabetic retinopathy. So reason for this is that blood sugar levels change quickly. It can affect the shape of the lens, cause blurry vision, which can go quickly back to normal once the sugar has been stabilized. So it's very, very important that People that are with optometrists, for example, in the examination room, in the case history communicates that this person has diabetes. On the file, somewhere, it needs to be indicated what form of communication needs to be taking place for you as a staff member, that you need to know, and what is it that you need to reiterate to the patient in terms of the education that needs to be done. Other things that we can talk about, for example, makeup usage, which is a big one, right? Especially for females. Depending on where your practice is located, other areas, maybe you're in a very high income earning area, middle income area, in a shopping center, basically anywhere where an optometry practice is located, a lot of women are using makeup, right? And so tips that you can provide consumers with pertaining to makeup usage are as follows. They should throw away their makeup after 3 months. Women, you know better, you should advise on this. Infection-causing bacteria grow easily in creamy and liquid eye makeup. And so if you develop an eye infection, or if they develop an eye infection, they need to immediately toss all of their makeup away. So it's very, very important that you know that you have educated patients pertaining to makeup. They should never share their makeup, and when sampling makeup in stores, use only fresh applicants and samples that have not been contaminated by multiple users. The safest choice is always to avoid store samples altogether, actually. If you tend to be allergic, introduce only one new makeup or care product at a time. If there's no reaction, add another new product, and so on. So that's a piece of advice or a tip that you can give a makeup user who's coming in and is loving the new pair of spectacles that you are recommending for them, and they've got multiple pairs of spectacles. You can see that this person loves their makeup. They're always having makeup. As a eyewear consultant selecting frames, have the discussion with the person. I used to do that a lot when I was in practice. Someone comes into the practice, I was in Rosebank at the time, and I can see that this person literally every time they come to the practice for whatever reason, or you can see that this person loves their makeup. When they're selecting frames, I would introduce this conversation of makeup in the frame selection, and I'm educating them whilst I'm doing what? Building trust, showing them that this is not about you just buying a pair of spectacles, educating them about the color. There's nighttime makeup, there's daytime makeup. Obviously, I used to talk to my wife a lot as part of my research, trying to understand that why do you put different type of makeup at night than you do during the day. There's makeup that is for the office, there's makeup that is for going out, there's makeup that is just a base. So as a woman, for example, you need to be in a position where you understand color tone, skin tone, frame usage on various makeup. How, when a person who's got lots of makeup on their face, when they take off their glasses and they putting them back on and off all the day, how often should they be cleaning their glasses? Part of cleaning the lenses is also cleaning the frames. How to take care of the frames on a face that is constantly using makeup. Those are things that are very, very important that you need to be aware of. And so, for example, one of the things as a tip that you can be able to communicate is ensure your face and eyelids are very clean before applying makeup. So you're communicating that with the patient, you're educating them. Always apply makeup outside the lash line, away from the eye, to avoid blocking the oil glands of the upper or lower eyelids. It's very, very important. So now you're bringing the eye component into the application of the makeup. These glands secrete oil that protects the eye surface. So a lot of people that are applying makeup are not aware of the role that the glands are playing in terms of protecting the eye surface. And so you need to communicate with them that they should not be separating their mascara clamped lashes with sharp items. Very, very important. If they tend to have dry eyes, they need to be avoiding a metallic or glitter, powder, or other makeup that flakes a lot. Very, very important. And so tell them that they need to remove all makeup at night before sleeping, especially mascara, as that can stick to the lashes. A lot of people are not aware of that. And if they have eye surgery, they should not be wearing makeup around the eye until the ophthalmologist tells them it is safe to do so, and then only use fresh new makeup. And pertaining to contact lenses as well, it's very, very important that you are educating them in terms of what goes first: makeup, contact lenses, or contact lenses and then makeup. When you're removing the makeup first and then the contact lenses. So those are some of the things that you need to take advantage of when you're communicating with your patients, and say, hey man, I can see you've got makeup on, and how often do you put on makeup? Do you love makeup? What's your approach to makeup, and then you bring the glasses component, you bring the health component, you bring the overall dynamics involved pertaining to makeup. Next one, dry eye, for example. It's one of the most common problems that consumers complain about on a daily basis. Every time we blink, tears spread across the cornea, right? And this is important because tears provide lubrication. They reduce the risk of eye infections. They wash away foreign materials and matter in the eye. And of course, they keep the surface of the eye smooth and clear. That's the purpose of tears. And so dry eye is basically a condition in which a person does not have enough quality tears to lubricate and nourish the eye, because the tear production and drainage is not in balance. So you just tell that to a patient, say, sir, we need to examine your eyes based on the following information that I've just provided to you right now. So you use this to educate the patient in convincing them why you cannot just prescribe eye drops for them, and why you need to do a full dry eye workup in order to determine what is the cause of that dry eye and what are the potential solutions. And so with the above information that I've just given you right now, it can result in a person experiencing any of the following: irritated, gritty and scratchy or burning eyes, a feeling of something is in the eye, excess watering and blurred vision. And so you telling them the risks associated with dry eye in terms of what causes them as well, versus what their visual experience is as a result of what caused them. And so the solutions that you could find as to address the problems that they're complaining about will require a full eye examination. And part of that eye examination is a full dry eye workup, which is very, very important for you to know as an eyewear consultant in communicating with patients, because once you have laid that foundation, they already know that it's not just about eye drops, it's not just about a pair of spectacles, that we are examining their eyes to determine, beyond what they're complaining about, what else could be wrong with their visual and health as a whole. And so there are also many other factors that people may complain of that are dry eye related. And so normal aging processes, especially in the people over the age of 65, women are likely to develop more dry eye as compared to men due to hormonal changes. Certain medications such as antihistamines, decongestants, blood pressure medications, and antidepressant medication can reduce tear production. I'm not sure if you are aware of that. People with rheumatoid arthritis, diabetes, and thyroid problems are most likely to have symptoms of dry eyes. Exposure to smoke, wind, dry climates, and long hours sitting in front of computer screens or digital devices can result in dry eye problems as well. And other factors such as long-term use of contact lenses, post-surgery complications may all result in dry eye. And so it's very, very important that as an optometric consultant, you can assist the optometrist with ensuring that the consumer has the following information that can help reduce their symptoms. Things like blink regularly when you're reading or starting at a computer or staring at a computer screen for long periods of time. Educate the patient. Increase the humidity in the air at work or at home. Wear sunglasses outdoors to reduce exposure to drying winds and the sun, of course. Nutritional supplements containing essential fatty acids may help decrease dry eye symptoms in some people. Drink plenty of water, 8 to 10 glasses a day. Those are some of the things that are critical in you being able to know and understand the impact that they have on people's eyes, so that when you are communicating with them in terms of a person is coming in about digital eye syndrome, pregnancy, diabetes, asking you about surgery, makeup, contact lenses, dry eye, all these things are complaints that you will encounter on a day-to-day basis. And so be in a position where you are able to educate patients about what is taking place with their eyes, why they have that, and why they need to be booking the appointment, what is going to be the possible solutions going forward. And the more you educate the patient gets trust. They get to establish or build trust between yourself and them right from the onset of that relationship that is going to be starting at that point in time. Other important information that you need to be fully competent and confident in is educating the patients on the policies and procedures in the practice pertaining to the following: spectacle breakage policy, lost spectacles and the replacement costs that are involved, warranty and guarantee policy of spectacles, chipped or scratched lenses solutions, that how does the practice go about fixing that, worn out frames solutions, what do you do when a frame is worn out, whilst it's still under guarantee, for example, insurance options that are available, optical benefits and payment options and responsibilities that the patient has. So you need to be confident and competent in this information that I've just alluded to now, because it's stuff that you deal with on a day-to-day basis. You shouldn't be scrapping around trying to look for the information when that situation presents itself. You need to already know that, oh, okay, so you've got you're complaining about a chipped or a scratch lens on your glasses. Let me pull out your file and check when you get your glasses. Oh, no, I got them 2 weeks ago. Oh, so no problem. This is the procedure that we need to follow. I need to ask you a few questions. I need you to just go over a few, whatever policy and procedure or protocol that the practice follows in any of the scenarios that I've just alluded to. You need to be confident that you are able to communicate this effectively to the patient. And so you need to be thoroughly you need to thoroughly understand that how all of this works. What are the cost implications to the business? Are you and the rest of the team speaking one voice pertaining to the protocol that you are having to follow as a practice? And so all of this is very, very important, that I just wanted you to understand that there are various situational examples that are happening at the level of staff that has got nothing to do with optometrists. And so it's very, very important that you are competent and comfortable in educating and communicating any of these situational examples that we have just alluded to.